Well, hi there and welcome to today's webinar, Transforming the Patient Experience with a Centralized Contact Center, hosted by Sutter Physician Services. I'm Lori Dearman, Executive Webinar Producer with WebAttract, and I'll be your co-moderator for today's session. And in just a moment, we'll be introducing a patient access expert and author as she shares how a centralized contact center can be an effective means of enhancing patient access, delivering a superior patient experience, while also improving financial performance. Sutter Physician Services, or SPS, has an intimate understanding of what it takes to deliver outstanding, affordable patient care. SPS's parent and largest customer is Sutter Health, one of the nation's top 5 private health systems. SPS provides an array of administrative and clinical services to healthcare provider and payer organizations nationwide, including a 24/7 contact center, billing, collections, clinical services, and more. We are excited today to give you insight to centralized contact centers, and you'll also have an opportunity to have your questions answered at the end of the presentation during the Ask the Experts panel session with our panelist, along with a representative from Sutter Physician Services. Now, for anyone who may be curious, we are joined on this webinar by professionals from across the country, and over the next 60 minutes, regardless of your industry segment or your location, we're confident that you'll find today's webinar of value. Also, we'll be sending to all of today's registrants a white paper called Centralized Contact Centers Addressing the Patient Access Challenge. So we certainly thank you for joining us. Now, at this point, I would like to introduce Danielle Stern of Sutter Physician Services, our host and our co-moderator for today. So over to you, Danielle.
Thanks, Lori, and hello to our participants. As mentioned, I'm Danielle Stern, Senior Director of Operations at Sutter Physician Services. Here at SPS, I know we've put a lot of time, knowledge, and effort into scaling a centralized contact center throughout Sutter Health and for some national clients. Today, our Salt Lake City Contact Center handles more than 7 million annual contacts, ranging from patient appointing to billing and patient portal inquiries. We've had the benefit of meeting and working with Elizabeth Woodcock, an expert in patient access and a respected author, and we're pleased to create this forum to have her share with you some of her insights on how to establish and sustain a contact center, which meets the needs of not only your organization, but also the most critical component of healthcare, your patients and their requests. Now, let's get started. We have a quick interactive poll for you. Lori, can you put that up for us?
Absolutely, and folks, coming up on your screen will be that first interactive poll, and we'd like to hear from each of you. Where are you on your centralized contact center journey? So is it that perhaps you've not started yet, maybe just beginning to centralize, partially centralized, fully centralized, or maybe in some other state? Okay, looks like 14% weighing in with not started, 21% just beginning, 48% our front runner for today with partially centralized, 7% fully centralized, 10% saying other. Want to thank you all for weighing in on that. And going to pass it back over to you, Danielle.
Great, thanks again, Lori. Now, it's my pleasure to officially introduce Elizabeth. In addition to what I previously told you, she is a speaker and trainer who is passionately dedicated to helping physician practices achieve and sustain patient satisfaction, improve practice efficiency, and enhance profitability. Elizabeth, I know that you've worked with a wide variety of physician practices and can give us some unique insights on opportunities that you see in the industry, specifically around the implementation of centralized contact centers. We're excited to have you here today to share your thoughts. Welcome.
Thank you so much, Danielle. It's truly a pleasure to be here. And of course, a special thank you to Sutter Physician Services. But most of all, thanks to all of y'all, our appreciation for joining us on the webinar today. And you might think, oh my gosh, a hefty goal. What does this have to do with contact centers? Wow. But what indeed this has to do with contact centers, the triple aim, we're all aspiring to population health in a cost-effective manner and really truly embracing the patient experience. I think this is an incredible strategy. That is contact centers in order for your healthcare organization to achieve it. Now, I want you to picture this. This is not just a way to answer phone calls, but if your contact center truly becomes a platform for patient communication, as well as that of our other very important customer base, our referring physicians, and then leveraging it to even become a patient accommodation infrastructure, and we're enabling ourselves to really hit these goals of the triple aim. Now, there have been a number of barriers in our journey to access historically. Answering calls is relatively simplistic. So what has been so difficult? Well, we have this massive and very complex regulatory environment, particularly associated with new patients. You think of a release of information and all the medical history that you need, and wow, I don't need to tell you this. Accommodating new patients is one of the most challenging steps for a healthcare organization. There's also this reality of human nature whereby you don't yet have a relationship with that patient if he or she is new, and then layer on top of that, the way our patients access us is typically not face-to-face, right? Sometimes we might have a patient show up to schedule an appointment in one of our offices, but normally our patients are calling us over the phone. Now, our referring physicians are faxing us or sending that request through our secure, encrypted online portal. So the realities of human nature are that a contact center has to control that experience, wow, without using any sort of body language. The nurturing, the empathy, all through the voice. And even if we accomplish achieving those barriers, climbing over them, we have this facilitation of access that really has been very, very limited thus far. We really haven't been configured to make it happen. Now, we do know that phone calls are coming in. In fact, I actually like to call our contact center agents directors of business development, because that's exactly what's coming in. We know that in our sites and our ambulatory locations, certainly a best practice is to encourage point of service scheduling, because that enables us to service the patient before they depart. That would be, as an example, a patient leaving your family medicine office who has been referred to gastroenterology, and so to go ahead and appoint that patient as he or she is departing. But what's fascinating is this patient demand is not only coming through the phones or the point of service scheduling, it's also coming through faxes, and oh, not just that, the secure electronic messages that are coming through our patient portal or HIE, and then, oh my goodness, our website is now accepting online requests. And then, by the way, did we mention that we've also contracted with a third-party vendor or two to capture patients as well? So there's this whole idea of all these different channels related to patient and referring physician demand. And because we haven't thought of a strategy to kind of really rectify all of these points, this has created quite a frustration for employees. Think about how many organizations do it now. You just answered on the poll that many of you haven't started centralizing or just halfway there. I bet phones are still inundating the front offices of the sites in your ambulatory enterprise. And so our directors of business development also have a lot of other responsibilities. This creates a problem related to attrition, and we also know that leakage is occurring. And no, folks, I'm not talking about leakage from a plumbing perspective. I'm talking about losing patients, because if we do not accommodate that patient demand, if we do not capture that patient's request, Our patients are departing. They're leaving us whether we know it or not. And that's a very critical point. And so a centralized contact center really enables us to focus in on these disparate points of demand, to be able to create an infrastructure to handle them, and of course to prevent leakage as well.
Elizabeth, thanks for touching on this. I know many of the provider offices that we work with are undergoing the same frustrations that you talk about. Without infrastructure in place, it's difficult to see the impact this changing landscape has on our patients. It's hard to understand what is creating the dwindling patient satisfaction scores or keeping people out of our offices.
You know, exactly right, Danielle. And I will tell you, there's some significant evidence of the problems, even if you just scratch below the surface. And I'm sure you have this experience as well, routing patients to voicemail, sometimes without even knowing that we're doing it. Oh, the unmanned extensions, and did I mention the incorrect numbers? Maybe somebody had that years ago and it's still on your website, still on your online presence. And then, my goodness, when referring physicians try to call us, try to reach out to us, we don't even answer the phone, all resulting in a poor customer service. And these are areas where I have a lot of healthcare organizations that say, oh, Elizabeth, this isn't us. We don't have voicemail. We don't have unmanned extensions. We don't have any of this. I'd encourage you to be your own patient, because sometimes we realize that we've kind of created our own little black market for healthcare because we know the places to call. Hey, we can just schedule an appointment ourselves. We don't have to be a patient. So please consider being a patient in your own organization, finding the phone number, calling, scheduling an appointment, really experiencing it as you would if you were one of your patients. Now, the opportunity is pretty significant, and you might say, well, why is it 2017? Why has it taken us so long to kind of realize that all of these opportunities are out here? Well, historically, the ambulatory enterprise of a healthcare organization either didn't exist, right, because we just waited for referrals to come in from the community, and so we just sat up there with our bed tower, and that was it. So, of course, 10 or so years ago, we started to look at buying physician offices, or we were employing physicians, and now, without going through all the interim, today the ambulatory enterprise is one of the most complex operations. I know I'm biased, but I do believe it's one of the most complex operations in any healthcare organization. And yet what we've done is not strategically thought about the conduit, the communication strategies with our customers. Think about it. Right, in our front offices, we have not only these directors of business development, but we also have, by the way, you're responsible for all aspects of point of service collections. Oh, did we mention denial prevention? Oh, yes, financial clearance is your responsibility too. Registration and insurance eligibility, gotcha. And then, oh my goodness, appointment scheduling's on you, and you do have to let us know that the patient has arrived, and smile, smile, smile when you pick up the phone. I mean, it is no wonder that access has really been left to dry, particularly when we layer on top of the fact that staffing within the ambulatory enterprise has not only failed to rise, but in most healthcare organizations, it has actually decreased in the last 5 to 10 years. And so, of course, this has resulted, I don't need to tell you this, in challenges related to the patient experience. Now, I would argue that it is very hard to really take advantage of this opportunity and to be able to leverage this to create value, whether we think of this through a communication strategy or a patient accommodation strategy, or we start to look at the future and kind of think about where population health fits into this. Our traditional one-to-one call handling, we can't leverage it any longer. It requires synchronous communication. We can't go anywhere from here. So we've got to think about this contact center again, not just in call handling, but what are the possibilities that a centralized contact center can offer us?
Now, Elizabeth, if I may jump in here quickly, you've covered a lot of challenges leading to opportunity. So I wanted to do just a quick poll to see what challenges our audience is facing. So folks, I'm going to go ahead and put that up on the screen for us, and we'd like to hear from each of you. Now in this case, you can select all that apply, but I'm asking on your honor system if you would give us your top 2 challenges among these. Staffing issues leading to unsatisfactory performance outcomes, administrative tasks resulting in focus being taken away from the patient experience, lack of reporting and analytics to provide you with timely metrics, or difficulty matching up supply and demand of patient access. And I mean by that is answering phones, emails, appointment requests in a timely fashion. Or perhaps some other challenge that you have that's unique to your organization or situation. If you have one of those, feel free to select the other and put it through the question panel as well. I do see another coming in from Amy, resistance to change of providers / admin. Yeah. Another one from Brandon, inconsistency in provider template. Chantel says communication. I got a few people weighing in with their others. Ray says non-standard processes between clinics. Okay, so 51% saying staffing issues, creating unsatisfactory performance outcomes, 43% administrative tasks taking focus away, 28% saying lack of reporting or analytics to provide us timely metrics, 53% difficulty matching up supply and demand of patient access, the 14% weighing in with other, got a couple more, Denise saying physicians not buying in because they lose control of their schedules, and Layla saying meeting certain value-based contractual requirements. All right. Well, folks, thank you so much for weighing in on those. I'm going to go ahead and pass it back to you, Elizabeth.
Great. Thank you so much, Lori. And we've certainly seen a lot of great challenges. Many of you experiencing a multitude of challenges, and yet I would really encourage you. You are obviously engaged, thinking about contact centers. Truly, this has become best practice in really leveraging a communication and accommodation strategy to launch a successful patient experience.
So, Elizabeth, industries across the globe have been using centralized contact centers for years, and within healthcare, specifically among hospitals, centralized contact centers have been emerging. But what has been the trend within the ambulatory environment? What are you seeing?
Well, Danielle, you bring up a great point. We've certainly seen other industries. I mean, we could talk about banks or airlines, for example. They've used contact centers for many years. And we've actually seen hospitals, like when we think about transfer centers, for example, they're like, oh, yeah, we got this. We've been using that contact center. But indeed, what's been interesting is that the contact center model has really only started to emerge in the last few years in the context of an ambulatory environment. And I think it has to do, by and large, with many of those barriers that we spoke of a few minutes ago. And I'm sure you all have that as well, Danielle. But when we think about the functionality of a contact center, really the advantages here are absolutely significant, and some of you pointed them out when you answered that poll. The provision of reporting and analytics, I mean, that alone is phenomenal, because when we think, for example, about those concepts, you know, I use the terms demand and leakage. Hello. I mean, what does that mean? Today's organization in an ambulatory environment, where I would argue it is the beginning, the initiation of the patient's velocity to care, right? I mean, that's where we want it to be. We don't want them to show up in the ED and initiate their care from there. We want it to be in the most cost-effective, listen to the triple aim, and the cost-effective setting of an ambulatory office. And yet we have no earthly idea what our demand is. We have no idea how many patients we're losing, what that leakage is. So reporting and analytics, wonderful asset related to our contact center. It enables us to really think about this idea of quick or first time appointing. This is a really big best practice that contact centers are focused on. How can we, at the first capture of that patient demand, at that phone call, at that referring physician office reach out, how can we schedule an appointment? Many barriers to doing so, but we're seeing organizations, boom, 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 taking down both internal as well as external barriers. We also know that if your contact center addresses prescriptions and clinical messaging, that enabling us to have a standard escalation protocol that all of our agents can access really is a huge value to a contact center. And remember the mention I made of really having to develop that relationship with only your voice. I mean, this is, I think, much more difficult than we give it credit for. So if we have a contact center, we can really, with a laser-like focus, ensure that we have a workforce that is not only professional experience, but enables us to deliver on that customer service promise. And then I've mentioned customers like patients and referring physicians, but in our poll, somebody mentioned a payer having value-based reimbursement, for example. A contact center can give us the infrastructure to take care of a particular payer, for example. Maybe we're at risk for a group of patients, a subset, a cohort of patients. We can have a direct line for them. We can, for example, begin to think about a network strategy, not just for our little ambulatory environment, but what about the network our health system is in? So how can we assist customers at a network level? This is really opening up a significant amount of possibilities. And then, oh my goodness, the automation we can deploy to really focus in on efficiency and service. I mean, this is tools like call recording. A number of you in the poll mentioned the challenges of physicians embracing this idea. One of the absolute best practices for a contact center is from the get-go, starting with call recording, so that you can really monitor those calls, quality assurance, but also gain trust from your physician stakeholders. Speaking of that, training efforts are critical, and we can focus those for our workforce and really think about QA or quality assurance. Now, we cannot dismiss the fact that we have a business to run. Our health system is indeed a business, and we have a very difficult time managing that in the ambulatory enterprise because of its disparate footprint. And so we have this whole idea to embrace a partnership with the revenue cycle so that we can begin to take those financial clearance, registration, insurance, eligibility, etc., and really be able to hone in on making those successful. I think perhaps, though, the biggest opportunity that we have in contact center, and maybe you would argue with me, but capacity is frankly where it's all at. The ambulatory enterprise, our greatest asset, is our physician and our advanced practice providers' time. And that time, as you well know, is defined by our schedule. And today, who manages the schedule in the ambulatory enterprise? Oh, in most organizations, oh my goodness, you start counting it, dozens, hundreds, thousands. How are we managing our greatest asset? Furthermore, when we think about our customer demand, let's say we have Ms. Jones call for an appointment with Dr. Smith. If it's a one-on-one relationship, right, Ms. Jones calling in for Dr. Smith, and Dr. Smith has nothing available, let's call her Sally. Sally, who is our Director of Business Development for that practice and does perhaps a very fine job at it, without a contact center cannot leverage that demand to say, you know what, Dr. Smith is not available. However, let's figure out if his partner, Dr. Wallace down the street, is available. Oh boy, we do have an appointment available. Looks like that location is even closer to your home. Let me go ahead and accommodate that. Wow, we can take capacity management to an entirely new level by executing an effective platform, a contact center that really enables us to match our organization's supply, that is the time of our physicians and our APPs, with the demands of our customers, and then creating a standard platform to enable us to have a great workforce and deliver on that consistent level of service at all times. So from a capacity management perspective, we can use a contact center to prevent leakage. Remember, that's the idea of losing the patient to another ambulatory enterprise, another health system. We can really focus in on that capacity and manage those appointment templates in a more effective, centralized fashion in order to optimize that awesome asset that we have, that is the time of our physicians and our APPs. We can take that demand from patients and referring physicians and we can route it more appropriately in order to match it with supply, thereby achieving the mission of really rendering quality care for our patients and taking care of our community. And wow, with those fixed costs that are inherent in the ambulatory setting, we know that a better use of capacity enables us to accommodate patients, which boost our profits as well. Oh, Danielle, it's a win-win all the way around.
Yeah, definitely. And I'm definitely hearing that execution is critical here, and SPS is familiar with that fact. But it's not as easy as it sounds. Can you share your experience in the industry?
Well, Danielle, you are totally right. You know, if we think about this as just like a call strategy, we're like, oh, I mean, we've been answering calls for years, Elizabeth. Come on, this is easy. Let's just get a building. Or my favorite is, let's just clean out a basement and let's take everybody who's been answering calls and we'll throw them into a workroom. And I got to tell y'all, and our audience knows this better than me, it's not as simple as you think. If we want to achieve the value proposition that we're talking about, I know these are lofty goals, but if we really want to focus in on demand accommodation, preventing leakage, I mean, reaching for that triple aim, we've got to make an investment. And that's really what I want you to think of it as. In fact, I will say right now that a best practice is to avoid making an investment into a contact center just to save money. Oh, we can save a lot of staff. That's a disaster waiting to happen. We've got to really think about what our outcomes are desired, how to implement that telecommunications platform that, just like an electronic health record would be applied to the patient flow, the practice operations, our telecommunication systems becomes the heartbeat of our communication and our patient accommodation strategy. And then we got to find the right people to do this. Now, finding the right people really requires focus on that team. A best practice is to create a professional career ladder for team members within your contact center, appropriate titles as well as pay grades. And I will say, in my experience, that is normally one higher than the front office of a medical practice. And then, importantly, teleworking. Oh, this work from home option for high performers is really going to enable you to not only capture great employees, but also to retain them. And of course, we've talked about not only staffing and orientation, but also training, and then having that great experienced leadership team that has truly the skills and expertise to manage this all. I mean, I wouldn't throw an EHR implementation in with somebody who, oh wait, well you ran our department of, let's say, physical therapy. I'm sure you can do this too. Oh no, a contact center is a platform which requires an astute planning and astute investment in order to really create the return. I do think it requires understanding what functions we want to have. Do we want to, for example, be a scheduling operation only? That is a choice that many contact centers make. So when a patient calls, there's typically a call distributor that would say press 1 to schedule, reschedule, or cancel your appointment, and that would drive right to that contact center. Or you become really the front door for the organization. So this may include a vanity number, a 1-800 health system, your vanity number, or it may include the legacy numbers that came into all of these practices. So what are you going to do? Are you going to be the front door clinical messaging, prescription refills, directions, and everything in between, or are you going to manage a single function within that area? And of course, we want to make sure as we execute a contact center, what are we talking about in terms of segmentation? Are we going to have everybody doing everything? Let's say you have 50, 100, 150 agents. Will they be stretching across all specialties? Or are we going to really think about service lines in what I typically see as pods within the contact center? And a best practice is to have an agent skilled in 2 areas, but once we go above 2, 3, and then 4, we really need our best agents to do that. Referring physicians versus patients, and then maybe even bifurcating new patients versus established patients, particularly in certain service lines, like I quite often see that in oncology. There's some really significant bonuses. There's intelligent callback technology. Some of us may have experienced that in other businesses, enabling you, if you're on hold too long, you can have the contact center call you back. So that's available to us in healthcare as well. Automated caller authentication, so that when I call from the number I have in the system, right, it automatically knows it's me. And then, wow, we can think about these complementary systems, workforce management, optimization solutions, predictive analytics. This might include predictive dialers, for example. If you are managing referrals, you may be making outbound phone calls, and so we see a lot of contact centers really deploying predictive dialers to be able to manage that outbound call volume. You might also be looking at analytics from a scheduling perspective, so that you're researching, you're integrating analytics from a propensity to show perspective, allowing you not just to willy-nilly overbook, but as I like to say, predictive overbook. And then of course quality assurance tools as well, like our screen capture, our call recording, wonderful assets.
Now I know you have this information coming up, but we found in our conversations with healthcare organizations that measuring success is an extremely important consideration, yet not as straightforward as one might think. We hear all the time about hurdles in implementing tools to measure or even define some of these systems.
You know, you're totally right. And so I think one of the most important things about a contact center is deciding your KPIs. Of course, I'm talking about this alphabet soup of key performance indicators. They can really measure the impact on the patient experience as well as referring physicians, of course our team members, the work environment, and then let's not forget our organization's bottom line. And so what might those KPIs be? Well, there are a ton of them, and I literally mean a ton of them for contact centers. I mean, I have a long history in revenue cycle, and I thought we had a lot of performance indicators in rev cycle. Oh no, we've got even more in the contact center space. I mean, abandonment rate, average speed to answer, schedule adherence, service level, and average handle time. Let's take a look at some of these, starting with abandonment rate, probably the most popular sort of overall indicator, because it just means how many calls, what percentage of calls have hung up before one of my agents can respond. And I think we really have a hefty responsibility in healthcare because this is someone's life, right? This isn't just a phone call about some silly bank account. This is a life. So we want to make sure we strive for what is much better than the industry average of a remarkably low 10%. We're seeing, of course, contact centers strive for 5% or maybe even higher than that. We want to make sure we grab those phone calls. The average handle time is sort of our call or talk time. This varies significantly based on the function that you have in your offices related to the contact center. So if you are grabbing more and more of those functions that have a higher talk time, obviously your AHT is going to be higher. It normally ranges from about 3 minutes to even over 6 minutes, depending on the function as well as the specialty. And I would caution you about studying this area alone as a KPI, because I've found that healthcare organizations that do, they're trying just to take a look at their average handle time, sometimes lose out on the patient experience. And so, oh goodness, we want to make sure that we also look at our schedule adherence. Our schedule adherence is that amount of time that's devoted to call handling as well as post-call work. And this is an area where we've seen organizations, just like they're looking at handle time, taking a look at post-call work to try to figure out how can I give more tools and resources to my team members to make sure they get the job done and get right back on the phone. You know what, Danielle, I know that you at SPS have a ton of experience with KPIs. Can you share some of that insight with us?
Yes, absolutely. And I think this will really help for those attendees who answered they were just starting their contact center centralization or they were just started on it. We saw about 35% of you responding that way. So when we first started out our contact center journey here at SPS, we ultimately first decided on ensuring that we had an appropriate amount of people answering the phones at the right time. And the metrics that we really focused on that Elizabeth shared with us here today were our abandonment rate, our average speed of answer, and service level. And then once we got those dialed in, that's when we really moved to average handle time and schedule adherence. And that way we were kind of taking it in bite-sized increments. But I know 28% of you said that you're struggling to even provide timely metrics, and hopefully this webinar will help with that a little bit as well. But what we've noticed after working with several healthcare organizations is the goal for individual metrics varies depending on function and complexity of workflows. So for example, if your vision is a team of universal agents with a high-touch patient experience, average handle time will be much higher. In contrast, if your goal is to have services segmented, you will see lower average handle times for the more straightforward processes and higher handle times for functions such as appointing with full registration. So just remember that as you're looking at industry standards, that it really varies depending on the experience you want to provide to your patients, as well as if the function of those calls that they're going to be taking.
You know, Danielle, that is such a great point, and it really brings home the fact that while we can take a look at KPIs as an industry-wide, boy and howdy, we need to focus on measuring ourselves and ideally getting better each and every day. And speaking of getting better, you know, we've talked about call handling and demand management and capacity management, maybe some of these fancy terms, but I got to tell y'all, I think the greater value proposition is actually looking at how we can leverage this infrastructure that we're creating of a contact center for the future. Remember we talked about those service lines, so maybe for example we could have a primary care service line in our contact center, maybe a women's services, musculoskeletal, etc. When we think about the future, we can start to take that concept of just demand management to demand routing. So let's think about, oh my goodness, Miss Smith who calls in for an appointment, maybe she has low back pain, she calls our orthopedic surgery line. And yet we might say, oh goodness gracious, Ms. Smith might be better served in our service line area related to pain management, maybe physiatry, perhaps even, depending on the protocols, therapy as well. So, wow, what an amazing opportunity to think about demand routing through service lines, through that incredible ambulatory enterprise. And that then leverages the contact center so that we're really becoming a stakeholder in improving the health of the community. And then you begin to get to be at the table as we start to think about our organization's population health initiative, particularly as in our Pop Health initiative, there's lots of discussion about communication. So that communication platform becomes our contact center. Instead of just thinking about all of the inbound communications that are coming to us, and maybe we've started to delve into referral management, so we're already managing some of those outbound calls, we now become the infrastructure that is dedicated to outbound call campaigns, preventive care, health maintenance, post-discharge, post-hospital discharge checks, or post-ED checks, chronic care management, and I could go on and on. Clearly, we have an incredible value proposition for the future if we're able to invest in a contact center, not just to manage calls, but to really think about how it fits in to our communication and accommodation and experience strategy. So our contact center then really becomes our opportunity to achieve goals. This is a win-win when we consider the relationships and the experience of our customers as well as our bottom line. And really the possibilities are endless, from a vanity number, nurse triage, prescription refills, capacity management, demand routing. I mean, it is so exciting to see the functions that we can really be able to leverage. Remember, we're moving away from this one-on-one where we really had no ability to leverage anything to an extensive array of possibilities. So this then positions your organization to not only manage communication, but wow, to go back to those lofty but I think achievable goals of the AAA. So Lori, I'm going to go ahead and pass the baton back to you.
All right, Elizabeth, thank you so much, and we'll let you get a sip of water. And folks, before we hop into some of the fantastic questions that we have coming in, going to do our third and final poll. I did want to share with you, if you'd like more information, some contact information here on the screen as well. If you're the tweeting type, a Twitter handle, or connect in with us. And going to just jump right into our Q&A right here. So I've got some questions here in the queue. I'll start this one here with you, Elizabeth. And the question is, well, this is probably going to go to both of you, but I'm going to start with Elizabeth. What do you both think is the biggest reason offices choose to go with a centralized contact center?
Well, I'll start off the conversation. I think it's the aha moment, Lori. It is the, oh my goodness, I either am a patient myself or I've heard so much from my patient satisfaction surveys, anecdotal comments, etc., that it's that aha moment that makes me realize in order to ensure a standard patient experience that is exceptional, I've got to do something about call handling. That's where a lot lot of it starts, at least from my end.
Definitely.
Right. Yeah, Danielle, go ahead.
Yeah, on my side, I agree with Elizabeth, and we see a lot of other organizations coming to us because they've experienced where their front desk staff are overwhelmed, they're having high turnover, they're having troubles backfilling those team members, and in those exit interviews they're saying, you know, it's difficult to keep up. A lot of the reasons that were on the poll before where, you know, my duties are all over the place and the patient demand is increasing and I'm trying to keep the physicians' schedules full to make sure that they have a busy day as well, because we all know physicians don't like to not be busy. So same as Elizabeth, but then also, you know, really those front desk representatives voicing their concerns and recognizing that definitely centralization will help with that standardization, as well as taking some of the workload off of the front desk representatives and providing a better, consistent patient experience.
Okay, on to our next question here. I'm going to start with you, Danielle. What are good skill sets to have for the staff in a contact center?
Yeah, I love this question. We get it all the time. And in our journey at SPS, we started with people who had medical experience, so maybe former MAs, front desk representatives as another example, and we really found that having team members who are customer service focused and excel in computer use, as well as are comfortable with providing that excellent patient experience over the phone, not necessarily face-to-face, were better attributes for our patient service representatives. That's what we call our phone agents. And so we've really kind of shifted to just somebody who has customer service experience and they show that they do have the acumen to work with computers, work in the contact center where they're receiving one call after the next. They like that high kind of pressure environment, but really that they're focused on that patient experience and they can connect their job to the healing experience of the patient.
Okay, question here for you, Elizabeth. How do you measure improved access and satisfaction?
You know, that's a really great question because if we think about, and I completely agree with Danielle, we've got the front offices who are saying we can't do this, we've got patient experience, we can't do this, and so we sort of throw our hands up and say, okay, we got it, we got it. But how do we measure success? Now, I think that we can take a look at all of those KPIs we talked about, and then we want to layer on top of that, of course, patient volume. I also like to hone in on new patients and really think about, because new patients in our environment is quite often tied to the CPT definition, that is, that specialty hasn't seen that patient in 3 years, but also think about net news or new news. So what is my access infrastructure? What is my contact center delivering to me in terms of new patients to my organization? And a great KPI for that is to look at your conversion rate. So this is the rate of phone calls related to demand. So the patient is asking something having to do with an appointment. How many of those do you convert to an actual appointment? So a conversion rate, really, really big KPI for those organizations that are focused on patient accommodation. Lori?
Absolutely. This one for Danielle. Barb's asking, could you verify the 5% ABD rate was an average or a goal? What is a good speed to answer number to use as a goal?
Yeah, absolutely. We use 5% abandonment rate, and for those of you who haven't started your contact center experience yet, that is the percent of calls that hang up prior to your agents being able to answer the call. So 5% abandonment rate is what we use as our threshold. What we usually see is an average between 2 to 3% abandonment rate. So really the 5% is more of a threshold for us, and we find that that really correlates strongly with the patient experience, because anybody who's called into a contact center, you're calling in for a reason, and if you hang up before you receive an agent, that generally correlates with a negative experience. As for a good speed to answer, number to use as a goal, we started off utilizing average speed of answer, but we shifted to service level. And service level is the percentage of calls answered within a certain time frame. What we utilize across our contact center is 80% of calls being answered within 45 seconds or less is our, again, threshold goal, which means our absolute must meet. And the reason for that is because it ensures a more consistent patient experience. So every single call is being measured, where an average speed of answer, you can have a lot of calls being answered within 1 to 5 seconds, and then you can have a couple of calls in that mid-range, and then a couple of calls that have a really long wait time, and it's not giving a full depiction of that patient experience. We still do like to use average speed of answer, though, just to make sure that that patient experience is there, as well as longest wait time to get a call answered. And when we utilize average speed of answer up next to service level, that 80-45 that I was talking about, we see it between 20 and 30 seconds average speed of answer.
All right. This went over to Elizabeth from Brian. What about triage? Do you see RN triage happening in call centers versus in practices?
Brian, this is a huge trend that we're seeing today. I would also throw in prescription refill management for that. So we're seeing farm techs, as well as I worked with a contact center recently that actually had Pharm D students who are rotating through their contact center. So this whole area of clinical call handling is really emerging, in addition to appointment scheduling, which is sort of the classic contact center, functionality. So definitely nurse triage, and I think when we consider any type of clinical area, we also have to think about, okay, could we even, for example, within our state scope of practice, handle prescriptions over the phone? So that's one area, and who would need to handle them? And so when we think about triage, what are the protocols, what are the call escalation protocols and the triage protocols that we need to have to really surround ourselves to think about delivering the best patient care in a compliant manner. So the trend is there. There's a lot of considerations that the contact center needs to make whenever we talk about integrating clinical calls of any nature. Lori?
Okay, thanks. And this one over to you, Danielle. Amy's asking, what is the industry staffing ratios that you see for call to FTE?
Great question, Amy. And this one's hard to just give a straight, this is the number answer to, and that goes back to what we were talking about in the presentation surrounding. It really depends on the length of your call, average handle time, which is it's measured differently in different contact centers. How we measure it is talk time, the amount of time the agent's on the call with the patient, hold time, so if the patient's on hold for some reason, which we try to minimize, and then after call work where our agents are working on that particular encounter after the call. So that's how we measure average handle time. And it really varies based on how long those calls are. So again, back to if you have that high touch concierge patient experience, it's going to be a much lower FTE to call ratio, where if you have a much quicker patient experience, then you're going to be able to have one FTE taking much more calls. For staffing, we utilize what we call the Erlang C model, and that's for inbound calls specifically. If you're using outbound calls, you can do more of a straight line calculation because you can predict when those calls are going to be being placed. But Erlang C is a model that utilizes the amount of calls coming in, the experience you want to provide to the patient, and then the length of those calls to provide you with what we use at a 30-minute interval basis of how many agents that you need. So I would definitely recommend looking into that to see what type of ratio you would need for the amount of calls and the length of time those calls are going to be to get to your staffing ratio of call to FTE.
Okay, got a question here. I'm going to start with you, Danielle, but Elizabeth, if you want to weigh in, you're welcome to do so. And that is, are there tips for getting internal acceptance of a centralized contact center?
Yeah, definitely. And I know we saw in the poll that, and we heard from some of the other responses that that seems to be a struggle, and it is for us as well. I think that the most important thing is I'll say two things. First, having a governance structure in place, and that's really having people who are tied to the project who are advocating, but also some people who are hesitant and have voiced their hesitancy, that you can get in a small group, what we call a steering committee, to really discuss the changes that are going to be being made. And then the other thing that I would recommend is ensuring that you have all levels involved. When we are working on our centralized practices, we involve frontline team members, we involve managers of what we call care centers or medical offices, we involve directors all the way to the CEO of the organization, and that way you have a lot of different input being provided, but you make sure that you're working with those closest to the work to ensure the solutions that you're coming up with are effective. But then when you get to the point where it's time to make the decision and give the green light and say go, that you have a governance structure in place to ensure that if there are any changes that need to be made, any issues that come up that you don't see, that you have a good structure in place to make those modifications quickly. Elizabeth, did you have anything to add on that?
Yeah, you know, it's such a great point to kind of think about this term of strategy, and we've emphasized, you know, moving away from this is just my call handling in a basement, put everybody together, but to really be at the top of the priority for the organization. I think from a tactical perspective, one of the things I would mention, and I know that y'all feel strongly about this at SPS, is to really be able to have documentation for the agents to reference, the call center representatives, our team members, so that our practices, our physicians feel very confident that they have the protocols related to scheduling, escalation, those red terms, red alert terms, so they really can deliver the best experience as well as the best care for patients. So I think tactically that's a great thing to mention in addition to the governance you talked about. Great point, Danielle. Lori?
All right. Well, Elizabeth and Danielle, we are at the top of the hour at this point, so I did want to just give each of you the opportunity to leave us with any closing comments. I'll go ahead and start with you, Elizabeth.
Well, I hope that we've talked about the value proposition of a contact center, and many of you had some challenges that you have on the table, and hopefully with the passion, the excitement related to a contact center, and the circle of possibilities that you've learned about today, that really can become the centerpiece of your organization strategy to achieve the goals of the Triple Aim. Danielle?
Yeah, definitely. And, you know, just taking the step to be here on the webinar today shows that you're considering moving in what Elizabeth and I would both say is, you know, the right direction, centralizing your patient experience, providing standardization. You really want to get to a place where the patient knows what to expect so you can become efficient and effective for that patient healing process. And like's been offered. If anybody has any additional questions, we definitely are available to you, and we'll make sure that we get back to you quickly. So feel free to reach out if something wasn't answered here, or if you have something additional that comes up after the webinar. And thank you all for joining.
Absolutely, and as Danielle said, there were so many great questions today, so if we didn't get to yours, you can expect an answer by the end of next week. And before signing off, we just want to thank each of you for joining. Trust that you found today to be of value. Of course, special thanks to Elizabeth and Danielle for sharing their knowledge today. Again, thanks for joining, and as your co-moderator today, this is Lori Dierman saying have a great rest of the week. Bye for now.